Human and livestock diseases can be difficult to control when infection lives within wildlife. European badgers are one species that are carriers of an infection called Mycobacterium bovis, also known as bovine tuberculosis, which is a zoonotic disease. The badgers pass the disease onto livestock, especially cattle, and from there the cattle themselves spread the disease from cow to cow by inhalation of the organisms in aerosolized. For 3 decades, badgers have been culled to eliminate the spread of tuberculosis, but despite these efforts, the incidence of tuberculosis in cattle has risen constantly, re-emerging as a primary concern for cattle production in Britain and the Republic of Ireland. Cattle are regularly tested for tuberculosis in both herds and slaughterhouses. The cattle are tested by either a skin test or a blood sample that is then tested in a laboratory. Animals that test positive for tuberculosis are immediately destroyed, and the infected herd are placed under quarantine and temporary movement restrictions. There are two types of culling treatment: localized reactive culling and proactive culling. Localized reactive culling sought to reduce the risk of tuberculosis in cattle while minimizing the number of badgers culled. Proactive culling involves widespread and repeated cullings of badgers across entire trial areas. While both methods work, studies show that substantial reductions in the incidence of tuberculosis in cattle with the near eradication of European badgers from large areas of land. Two studies in the Republic of Ireland and one in Britain have associated substantial reduction in the incidence of tuberculosis in cattle with the near eradication of badgers from large areas of land. A total of 6 main areas, ranging from 104 to 528 kilometers square. A field experiment conducted in Britain, also known as a randomized badger culling trial, indicated higher cattle tuberculosis incidence in 9 study areas, each approximately ranging 100 kilometers square, where badgers were culled locally, averaging an area of 5.3 kilometers square per cull in a response to specific cattle tuberculosis outbreaks than in nearby areas randomly allocated to a no-culling treatment. Culling badgers has both positive and negative effects on the incidence of tuberculosis in cattle, which has important implications for the development of sustainable control policies. Culling does reduce the cattle tuberculosis incidence in the areas that are culled, but increases incidence in adjacent areas.